So it could be the next health crisis to hit our country. More Americans battling late-stage cancer. It's because the pandemic has delayed screenings and detection. Good Morning Cleveland anchor Katie Houston learned it could have a major impact on outcomes and survivability.
No excuses. Get screened for colorectal cancer. That's the message. And the messenger teeing it up, 46-year-old Melvin Fernandez of Lyndhurst.
Don't be afraid of it.
March is Colorectal Cancer Awareness Month, and Mel, a spokesperson for a new national campaign.
I was only 42 years old. I was in really good health otherwise.
It was his brother, who lives in another state, who noticed a change in Mel's weight and appetite when the two met up at a PGA golf tournament.
And he thought that I should go get checked out.
Their annual brotherly tradition saved his life. Mel saw a doctor when he got home, and a colonoscopy found a large tumor. He had part of his colon removed, as well as his bladder. Unfortunately, the cancer spread to his liver and lungs.
So over the last 4 years, I've had 2 surgeries on my liver and radiation on my lungs. So it's been a bit of a long journey.
Colorectal cancer is the second most common cancer death in the United States when men and women are combined. It's on the rise among young people. That's why the American Cancer Society now recommends people with an average risk start getting screened at the age of 45.
Colonoscopy, if negative, you're usually good for 10 years then before you have another one.
Dr. Liska says colon cancer is one of the most preventable and curable cancers when caught early. But here's the problem. The COVID-19 pandemic has caused a delay in all cancer screenings, diagnosis, and treatment, says the American Cancer Society. For example, screenings for colorectal cancer alone down nearly 90%, which Clinical Oncology News estimates will result in a 12% increase in deaths over the next 5 years.
Do you think because of this pandemic that we will see more people fighting late-stage cancers down the road and perhaps sadly even more deaths that could have been prevented?
I'm afraid that it might happen.
Dr. Liska says it's already happening here at home with his patients.
They had maybe some symptoms or they were due for a screening but delayed it because of the pandemic and then presented 6, 7, 8 months later with a relatively advanced cancer.
He says you're safe to see your doctor. The pandemic precautions and guidelines are protecting both patient and provider.
And we urge all our patients to really make sure they take care of themselves during this pandemic and make sure they don't miss out on important screening.
Mel has continued to visit his doctor for treatments during the pandemic. He hopes his story hits home with you and you don't delay your cancer screenings.
Having discomfort for one day could save you for the rest of your life.
In Cleveland, Katie Houston, News 5.